Hi, my name is Charlotte.
Hi, my name is Cody E. Atkinson Siolo.
Hi, my name is Tai Toa.
We're doing our case study on congenital heart disease.
On our first slide, we have our patient and its symptoms. Our patient is a newborn child, and our newborn child symptoms are rapid breathing and heartbeat. Next is the swelling in lungs, belly, and eyes, shortness of breath, extreme tiredness and fatigue, and lastly, blue tinge on skin. The blue tint is most common and noticeable in newborns. Most of the time, they catch this before birth, but sometimes they don't. And that's what's happening here.
Clinical staff and what they will do. The clinical staff noticed the irregular breathing patterns and the blue tinge on the skin. So they will do a echocardiography, which checks the inside of the heart, a electrocardiogram, which measures the heart's electrical activity, a chest X-ray, which can be used to measure the excess amount of blood in the lungs, a pulse oximetry, which measures the amount of oxygen in the lungs, and a cardiac catheter catheterization, which sees how the blood is being pumped through the heart.
So the test results found that the echocardiogram located the coarctation and the severity of it. The electrocardiogram demonstrated that there was ventricular hypertrophy, which is the thicker walls of the lower heart chambers, which demonstrates that the heart is needing to pump blood a lot stronger to the rest of the body. The chest X-ray is notices the narrowing of the aorta and demonstrates the coarctation, and the cardiac catheterization demonstrates severity of the coarctation. So for treatment, after running the test, it looks like our patient has congenital heart disease in the form of coarctation of the aorta. Coarctation of the aorta is a narrowing of the aorta, which makes it difficult to pump blood to the rest of the body. This is a severe type of congenital heart disease, and surgery will be necessary. So there's a couple options for surgery. One is the removing of the narrow end of the aorta and reconnecting the two remaining ends, inserting a catheter into the aorta and widening it with a balloon or stent, or removing sections of other blood vessels and using them to create an aorta in the region of the coarctation.
As we move to our next slide, we ask ourselves, what is congenital heart disease? Well, congenital heart disease is one or more problems with the heart structure. Here we have all people who have congenital heart disease are born with it. And next, we have symptoms appear periodically. Some defects are noticed in the womb, while others find out much later in life. Here on the left side, we have non-severe types. This includes atrial septal defect. Um, Next, we have the atrial ventricular septal defect. And last, we have ventricular septal defect. On the right side, we have severe types, which include double outlet right ventricle, transposition of the great arteries, Epstein anomaly, hypoplastic left heart syndrome, interrupted aortic arch, and pulmonary atresia.
In conclusion, congenital heart disease comes in many different forms, but the coarctation is one of the more severe forms of it. If the coarctation was not found while the child was in the womb, the most common sign of the disease would be the blue tint on the skin, and surgery would be required to continue on a path towards a healthy life.
Here are our sources, and thank you for listening.